Well, I'm a native-born Cajun, so I'm from Louisiana. Currently, I am the Vice Chief of Anesthesia in Montgomery, Alabama, which is also Premier's flagship practice, so one of their first. I went to undergrad at Baylor University, Waco, Texas. I would say currently right now my other home is Texas. I did all of my training in Texas. So after Baylor, I went to the University of Texas in Houston. Very large medical center. I spent a decade there. And then after that, I went into the United States Air Force as an officer, active duty. Well, when I was training in medical school, that's actually a really good question because I was very undecided on what I wanted to do. I was kind of deciding between emergency medicine or trauma surgery, and when I was on my surgical rotation, I noticed that basically all the anesthesia team or the anesthesiologists were very cool and they were very happy. So that was very influential for me as a physician because this can be a very grueling work environment sometimes, or let's say field of practice, so I wanted longevity. So the people that are always happy in anesthesia was something that caught my eye. The field of anesthesiology is very diverse. You work with all types of and kinds and ages of patients, right? So patients who are pregnant, pediatrics, geriatrics, and they're all different fields that you work in. So trauma, OB, urology, pain medicine. I'm also boarded in pain medicine. So that's more clinic medicine. So very, very diverse as far as what your interests are in the field. What I love about Baptist are the people, first and foremost, okay? The surgeons are amazing to work with, the CRNAs, the nursing team, amazing. The admin staff, great. And as you know, that, at least in my opinion, that the people that you work with can make or break you. So when you have toxic people, it can really make the work environment hard. So I've worked all over Texas, I've worked all over Florida, I have every medical license in every state. And so I've worked at several different places, and I will tell you that this place is a true utopia in regard to the way people treat each other. So the reason why I like to work for Premier Anesthesia is the interaction between the corporate side of medicine and, let's call it, the medical side of medicine. And I would say that probably the future of medicine. I don't know a lot of private practice physician-owned groups anymore. The other place that I work is Texas, and there's some really large corporate complexes there. Premier has always been very helpful in regard to helping me grow as a physician. I'm still the first, let's say, third of my career. And they've also been very supportive in me as an administrator or an executive position in Montgomery, Alabama. So Premier's been very supportive to me as a physician, and I'm also a leader in my practice. The one thing that I've learned about leadership is if you don't provide your people a structure, it's not going to work out for them over time. They'll most likely leave or they won't feel protected, and I think the Premier does a good job of providing me a structure to grow. I love anesthesia because you never know what you're going to get. When I walk into the door of the hospital, at my particular practice, I'm covering several areas or sites of anesthesia. So that could mean very sick patients, very healthy patients, elective procedures, trauma, pediatrics, pregnant patients. And then on my team, I'm also an executive position, so I work with the admin side to manage people and work with other doctors in the hospital. So again, it's a very diverse position, and I will tell you this, it's probably one of the most needed positions in the hospital. Everyone needs anesthesia, so for me as a physician, I like to be needed. I would say in anesthesia, and I'm biased, but we save lives every day, right? So our skill set is getting you safely through a procedure and giving you medication that could essentially kill you if you're not careful. I am reminded of a time So within that context, I will tell you a story of the time that I was actually really impressed with the human race. So after my residency, I was deployed to Afghanistan. And as you might imagine, it's a very austere place to practice anesthesia. Oftentimes, we were in the mountains of Afghanistan, and oftentimes you don't have supplies or sometimes the components that you may need to really give the patient what they need. We had a trauma come in one day, and it was one of our Special Forces unit members that I knew very well. And he was on a patrol on a four-wheeler, and he ran over an old Russian landmine. They didn't know that the landmine was there. So he came in with injuries to the lower abdomen and lower extremities. Of course, it was a very grueling surgery. And at what point in the surgery, I was kind of at a loss. We had no more. I'd given the patient everything we had in our little unit hospital. So all the blood I had and all the plasma. And I remember feeling very helpless at that time. So I called to my OR nurse, and we did have another ER staff nurse outside, like, hey, I am out of all the products we have. Like, we need to do something. Basically, death was imminent. And so they had an all call on the base and basically called out over the intercom that we need people with this patient's blood type. And within about 4 minutes, I had 30 people at the door that were of the patient's blood type. And we took the blood from one patient, one unit, and then gave it to our patient, which is, one, not something that you get to do in regular practice, but two, we calculated 18 units from 18 different people that saved this man's life. So that patient was able to make it safely back to Germany alive. So for me, that was a huge experience in my career, showing the beauty of what humans would be willing to do to save another life. I like to exercise, right? So working out is my passion. The other side of my career is running a functional medicine clinic. So getting people off their medicine, teaching people how to move, right? Which in 2024, you'd be surprised. Not a lot of people move or even know how to move their body. And then that translates into my home life, right? So I would say that exercising for me is not just a hobby, it's therapy, right? So when you're dealing with a work environment where people can get hurt and sometimes it's very stressful, you need an equal and opposite de-stressor. So for me, that's exercise, and then right after that, the sauna.